Pregnancy signs and symptoms. While pregnancy tests and ultrasounds are the only ways to know if you're pregnant, you can look out for other signs and symptoms. The earliest signs of pregnancy are more than a missed period. They may also include morning sickness, smell sensitivity, fatigue. When do the symptoms start? Though it may sound odd, your first week of pregnancy is based on the date of your last menstrual period. Your last menstrual period is considered week 1 of pregnancy, even if you weren't actually pregnant yet. The expected delivery date is calculated using the first day of your last period. For that reason, you may not have symptoms during the first few weeks of your 40-week pregnancy. If you're pregnant, you may notice early signs such as mild cramping and spotting, missed period, fatigue, nausea, tingling or aching breasts, frequent urination, bloating, motion sickness, mood swings, temperature changes. Other signs may include high blood pressure, extreme fatigue and heartburn, faster heartbeat, breast and nipple changes, acne, noticeable weight gain, pregnancy glow. Number 1. Cramping and spotting during early pregnancy. From weeks 1 to 4, everything is still happening on a cellular level. The fertilized egg creates a blastocyst, a fluid-filled group of cells, that will develop into the fetus's organs and body parts. About 10 to 14 days, week 4, after conception, the blastocyst will implant in the endometrium, which is the lining of the uterus. This can cause implantation bleeding, which may be mistaken for a light period. It does not occur for everyone. If it does occur, it will usually happen around the time you expect your period. Here are some signs of implantation bleeding. Color. The color of each episode may be pink, red, or brown. Bleeding. Implantation bleeding is usually much less than your usual period. It's often described as light bleeding that never turns into a flow or enough to need a tampon. Pain. Pain is usually milder than your usual menstrual pain. It may involve some cramping. It can be moderate or severe, but it's most often mild. Episodes. Implantation bleeding is likely to last less than 3 days and does not require treatment. It can sometimes last only a few hours. If you think you may be experiencing implantation bleeding, avoid smoking, drinking alcohol, or using illegal drugs, all of which can be associated with heavy bleeding. Do not use a tampon if you think you may be having implantation bleeding and not your usual period. Using a tampon could lead to a greater risk of infection. Number 2. Missed period during early pregnancy. Once implantation is complete, your body will begin making human chorionic gonadotropin, HCG. This hormone helps the body maintain the pregnancy. It also tells the ovaries to stop releasing mature eggs each month. You will likely miss your next period 4 weeks after conception. If you typically have an irregular period, you'll want to take a pregnancy test to confirm. Most home tests can detect HCG as soon as 8 days after a missed period. A pregnancy test will be able to detect HCG levels in your urine and show if you are pregnant. Tips. Take a pregnancy test to see if you're pregnant. If it's positive, call a doctor or midwife to schedule your first prenatal appointment. If you're on any medications, ask your doctor whether they pose any risks to the pregnancy. Number 3. Raised body temperature during early pregnancy. A higher basal body temperature may be a sign of pregnancy. Your body's core temperature may also increase more easily with exercise or in hot weather. During this time, make sure to drink more water and exercise cautiously. Number 4. Fatigue during early pregnancy. Fatigue can develop anytime during pregnancy. This symptom is common in early pregnancy. Your progesterone levels will soar, which can make you feel sleepy. Tips. The early weeks of pregnancy can make you feel exhausted. Try to get enough sleep if you can. Keeping your bedroom cool can also help. Your body temperature may be higher during the early stages of pregnancy. Number 5. Increased heart rate during early pregnancy. Around weeks 8 to 10, your heart may begin pumping faster and harder. Palpitations and arrhythmias are common in pregnancy. This is normally due to hormones. According to a 2016 review of studies, your blood flow will increase between 30 and 50% during your pregnancy. This adds to your heart's workload. You may have discussed any underlying heart issues with your medical team before conception. If not, now is the time to discuss any conditions or needed medications. Number 6. Early changes to breasts, tingling, aching, growing. Breast changes can occur between weeks 4 and 6. You're likely to develop tender and swollen breasts due to hormone changes. This will likely go away after a few weeks when your body has adjusted to the hormones. Nipple and breast changes can also occur around week 11. Hormones continue to cause your breasts to grow. The areola, the area around the nipple, may change to a darker color and grow larger. If you've had bouts with acne before your pregnancy, you may experience breakouts again. Tips. Relieve breast tenderness by purchasing a comfortable, supportive maternity bra. A cotton, underwire-free bra is often the most comfortable. Choose a bra with varying clasps that gives you more room to grow in the coming months. Purchase breast pads that fit into your bra to reduce friction on your nipples and nipple pain. Number 7. Changes in mood during early pregnancy. Your estrogen and progesterone levels will be high during pregnancy. This increase can affect your mood and make you more emotional or reactive than usual. Mood swings are common during pregnancy and may cause feelings of depression, irritability, anxiety, euphoria. Number 8. Frequent urination and incontinence during early pregnancy. During pregnancy, your body increases the amount of blood it pumps. This causes the kidneys to process more fluid than usual, which leads to more fluid in your bladder. Hormones also play a large role in bladder health. During pregnancy, you may find yourself running to the bathroom more frequently or accidentally leaking. Tips. Drink about 300 milliliters, a little more than a cup, of extra fluids each day. Plan out your bathroom trips ahead of time to avoid incontinence or leaking urine. Number 9. Bloating and constipation during early pregnancy. Similar to symptoms of a menstrual period, bloating may occur during early pregnancy. This may be due to hormone changes, which can also slow down your digestive system. You could feel constipated and blocked as a result. Constipation can also increase feelings of abdominal bloating.